Anne.
Kim, long time no see. I'm excited to be on and thank you for having me here today.
Yeah, thanks for coming. How's business going?
Well, business is going well. It's been a crazy few years, I think, for everybody, right? The pandemic threw us all into this world that who knew we would be living through, and not only owning a small business through it, but owning a healthcare small business through it has definitely tested my resilience in ways I did not think would be tested. But it's exciting to say we are coming through it. We actually had our best month we've ever had as a business in 10 years last month,
Really?
from our numbers. So it's pretty cool to see that it's coming back stronger and patients are feeling safe, coming in, wanting to get the care. I think they're prioritizing their wellness. The pandemic kind of made everybody self-reflect a little there. And so my theory is that a lot of people are putting that in the forefront now of their life. And so, yes, our numbers from a business standpoint are reflecting that.
That's amazing. You came back with a vengeance.
We did. You know me. Yeah, I try to obviously push through and be smart about it, but also the fun part of the business and coming back and making it a fun, safe place for patients to come back to do our part.
Yeah, and you kind of had to change the way you did things, and some of it
Correct.
probably stuck, right?
Yes. So I think that that's like a great point. Early on in the pandemic, we didn't know a lot. We didn't know what was safe, what was not. We felt that as physical therapists, we had a bigger role in healthcare, and the biggest goal was keeping, people out of the emergency room, so that we could help have those emergency room beds and doctors available for patients with COVID and more priority needs. So as physical therapists, it is important that we play a role in that. And we felt that way. Why we chose to stay open through the early pandemic is if we could be a frontline provider for those musculoskeletal injuries, patients that hurt their back, and let's say they didn't need to be in the emergency room. Maybe normally they would go and then be referred to PT. If they can come directly to us as medical providers, that's going to unload the healthcare system where it was needed with COVID, but allow us to play that role to be a frontline provider, which we're educated. We have our doctorate degrees. And most insurance companies allow you to come directly to physical therapy now.
Yeah.
But let us fill that void. And as you were just saying, I think the neat thing is that education got out there to the public. We've been working on that as physical therapists to try to educate the public. But during the pandemic, that really was a stronger push. And I think now we're seeing that benefit that people are coming in, they're using our services. Another one is telehealth. The virtual medicine world, both in medical doctors as well as physical therapists, has exploded, and people are see the need and the value that maybe you don't need to drive, to physical therapy, or if you do just even have a cold and you don't want to expose others, you can still continue your care and not have to be exposing others or driving. So it's been a really neat, in that sense, way to kind of flip a negative situation and look at the positive and the benefit that hopefully going into the future, we're going to be able to have in this industry.
Yeah. Do you think the telehealth will continue?
So I would say I would love it to, because I think there's so much value there. It is a fight with the insurance companies, to be perfectly frank, right now. Right now, the insurance companies, which most of our patients are being seen through health insurance, and I'd say kind of most clinics and hospitals, people are being seen through their health insurance. So though they dictate those benefits, if people are allowed to come and have it paid for by them, they right now are still stating that if we are under an emergency order, then we are allowed to have telehealth benefits, virtual care benefits. There are a few plans that will allow it even outside of the emergency state. That is part of where our governor is, looking at that. And I think he understands that pretty well. I feel like he is, in that sense, not to get political, but done a good job of understanding the complexity of the situation, and keeping that is going to help a lot of people for the care they need. So hopefully right now we have it under cover, being covered, but we would like to see that go into the future too. I know our industry and some of the medical providers are really working from a legislation standpoint on trying to keep that as a benefit, just because there are values far past the pandemic.
Okay. So I wanted to ask you,
Yes.
what led you to becoming the fabulous physical therapist that you are? Tell us about your journey.
Let's hear about my journey. No, I appreciate the compliment first. A shameless compliment. Okay. My journey, I think started like most people, I would say, actually, in this, if I really I'm introspective and look back in childhood, where I was always an active kid, not just with sports, but just I loved being active. I am really lucky in that I have two parents that are also very active and promote kind of that health, fitness, wellness lifestyle. So there was early on a promotion of that. I had played sports through high school and had some injuries that kind of made me look at the career as a potential. When I had to go through my own physical therapy, I always felt like I wanted to give back to others. I like caring for people. And so as a kid, you don't really know much about the other medical industry. So I thought, I want to be a doctor. And then learning about that physical therapy as an option. And then in college, I took some time to really explore it more, volunteered at different settings to see, is this something I can see myself do every day? And what does a day in, day out, professional PT look like? And I found that I loved the fact that you really get to follow people on their journey. I think much more than sometimes medical doctors, where you might see them and then it might be 6 months, a year before they have, a follow-up, a wellness check, or just, come back, they're sick. Whereas a physical therapist, we really get to know our patients, and we might see them 2-3 times a week at first during an acute injury. There also is a tremendous part of our career that is built on trust. We are caring for people when they're hurt, when they're vulnerable, when they can't do things that they want to do. And for me, it's really important to establish that relationship and trust, because if I'm caring for their body and they're going to be able to, tell me what their goals are, because I want to meet their goals. If I have a goal and they don't care if that's met, it's not going to help either of us. So to establish that trust so that we can go forward and meet their goals was really important to me. So kind of to come full circle, I was able to see that and look at myself at what I needed, what I was able to give back to others, and then kind of took the step to get into PT school and got in a great program down in California, where I took a little move, did my program, and then came back up and have been practicing in Washington, and then have owned the clinic the last 10 years.
What made you want to start your own practice?
Well, so there are a few different things, actually. I saw a need for setting the standard of care that I unfortunately was not feeling like was being fully met at places that I was working. Not to speak poorly of anyone. I think they were doing what was best for them and what they saw as style of care, or various reasons for, running their business the way they did. But for me, there's a pretty strong value and belief in, how good medicine should be delivered. And our clinic runs with one-on-one care model. So every patient is being seen by a doctor of physical therapy, and we have longer appointment times. We don't treat patients as a number. And that is very important to me. We treat people as a whole person. And I think patients right now, see that and see that is a very different style of medicine than just you're checked in. I do cookbook therapy where, everybody that has an ankle injury is treated the same. That's not good medicine, and that's not what I wanted to run. And so in kind of deciding to take this into my own hands, and then, having the clinic in our community, that was important to me as well. Is I wanted to give back to this community. I love this place, and I want my friends, neighbors, family to be able to come and be cared for there. So opening in Snoqualmie was also important. Finding the right business partner, the right space. So kind of everything came together, and we were able to establish the practice and be able to not, care for patients, but also care for our staff. That was important to me too, is setting a tone at work, because I've worked places too where, again, you're just a number as a staff member. It's not just the patients. And so I felt pretty strongly that I wanted to set up a clinic where people felt special. They felt like they were part of that process, that we truly are a collaborative team as a unit. And I'm not above taking the garbage out if it's needed to, but also if something is needed where the front desk needs to step up, and help me out, they can do that as well. And I think we have that. And it's what patients comment all the time, like, oh, it's just different. You guys are fun here. And we laugh a lot. We have, like, today I have my fun socks on. It's Fun Sock Friday. We've had this little patient that decided that she's a teenager and I guess cool, different socks are in. I've learned I'm old and middle-aged, so I don't know that. But so she got excited about this. So we're like, okay, we're going to find some fun socks and impress her. So we all got our these fun socks. And she literally every time now when she comes in on Friday, we all have different fun socks on. And so it's just little things like that. I think that's an anecdote to kind of how we run the practice and kind of who I am as a person. I want to make sure I am enjoying the ride and happy and having fun while doing it.
Yeah. And I have fun going in there.
Well,
even if I'm hurt and I can't walk, I'm like, I can't wait to get in there. It's so fun, but but it's okay because it's fun. And I like that you have the one-on-one care, because I've gone to other PTs where you have a therapist and they see you for a second and they go, oh, you're going to go off with this person that you don't know. And they don't know everything about what's going on. So that's why I really like coming in there. It's very personalized.
Well, thank you. And thank you. I mean, I think you just said it, right? So as someone that, has been there, like you said, we want it. And that honestly is music to my ears because it is fun. And I think you just said it too in the second piece of my point earlier about trust, right? If you're just suddenly shuttled to someone that you don't know and you don't even know who you're going to see that day, it's hard to trust your body with them, which then not only are you not going to get the care you deserve by that, but physiologically, your body has a response to that. So it is not going to respond as well. So there's a mental part to getting better as much as a physical. And I feel like through my 20 years of practicing, if I've learned anything, that is almost more important than the physical piece. Like I can do the mobilization or the correction, but if we don't establish that mental piece to health and wellness and trust there, that you trust what I'm telling you, then you're going to buy in. You're going to want to do it. You're going to trust that there's probably going to be a little pain in it, but as you know, it's hard early on, if somebody's telling you to do something and you hurt, to really be like, does she really know what she's talking about? And is this going to get me to my goal? But once you establish that, it's like, oh no, I know she wouldn't put me in a position. We're going to work through this as a team together to get to that end goal.
Yeah, I totally trust you with my body. You're the first one I call when there's anything wrong. I call you because I totally trust everything you say and do, even if it hurts a lot.
And sometimes it does, right? And that's the scary thing is like when you're hurting, when you have that mental overlay of fear there too. But like you just said, it's neat when you do have that. And I think that's been my favorite part of the practice and now being established there for the last 10 years is having people like yourself where it's neat to go through this journey. It might be 2 years and you're doing awesome. And we just see each other at the grocery store and it's like, hey, I'm doing really well, but then when something does come up that it can be that relationship where you can say, hey, I need your help. We already know the history. It's fun because you know me, I know how your body works and what it responds to, that I still have to do my due diligence, obviously as a medical provider, and make sure I'm evaluating, figuring out what's going on, putting that puzzle together for you. But some of that groundwork has already been laid. And so now we can just get right to the good stuff. And I think most of my panel that I treat right now, that is the case. I have a few new ones that come in here or there, but I see a lot of my second or third offenders, we call them, where it's yes, you may have already had an injury in the past. You've maintained and done really well, but you know who to call when you are hurt. So it's a huge, biggest compliment I could get from anybody, right?
Yeah, I love coming there. And
sometimes
I think I want to go hurt myself just so I can
please do not go hurt yourself. No, I will go to coffee with you. I'll do a podcast with you, but don't go get hurt for this.
I'll try not to.
Those are famous last words. I want you to knock on wood right now too.
There was the microphone. Okay. Knock. Okay.
No, don't ruin everything. We're good.
Okay. So do you get patients who exercise a lot like myself? who've become injured and have to start from square one with absolutely no exercise? And also, why is it important to start from square one?
Great question. Yes, like yourself, you just said, but yes, we see the variety, right? You run the full gamut from people that have never done a lick of exercise in their entire life. And the idea that I'm having them do a stretch or something to strengthen is new and it's foreign to their body. So then my job, right, is to meet them where they are, that we've got to start and just kind of introduce exercise into their body and why that's important, and get them on board there versus the flip into the scale, like you, where you live, breathe, it's just part of who you are, right? And I'm right there with you. So I can say that with all the love and kindness. It's a part of who I am too. So both of us, it would feel weird the opposite way not to be moving and exercising in your life. And so then with those patients, when you are injured, and I've been through it, you've been through it, it's challenging. It's challenging when this is just who you are and it's ingrained in you to not be able to move. And so you're correct. You do have to kind of take it back to square one, establish, the body's movement patterns properly again, because pain does a number on our nervous system and our muscles, and it kind of scrambles the message. Our nerves are like a wiring system in our body, and those wires get crossed. And so that's part of why we start over. We also start over to make sure that the mechanics are sound. So if you have learned a habit, and let's say you're doing squats, for example, but no one ever taught us how to squat correctly per se until you usually go to physical therapy, then they may say, okay, hey, there's a better way to do it. Or for your injury, there's a better way to do it. Maybe you and I do them differently. But for our bodies, how we're built and put together, there's a proper way to do it that puts the least amount of pressure on the joints or the injured area. So that's part of why we kind of back up sometimes too, even though that might be frustrating to patients to feel like, wait, we're going backwards. But I think as long as we can educate them on the reason that we're stepping back and establishing that, then they kind of understand and are able to buy into that process. And then we can choose how fast we go through it. So are we able to accelerate through with someone that does have good sound movement mechanics and has done exercise, or do we have to back up and say, like I said, no, we've got to spend a little more time on this.
Yeah. And you usually, like with me, you added one thing back at a time.
Yes. So I try to be scientific, even though it's easy to get excited, whether the patient or me as a therapist, I'm human too, and say, ooh, we're excited to get to the good stuff, right? Especially as people are feeling better. We all want to get to the fun stuff. We're human. And so it is easy to just say, let's add a bunch of stuff and just go for it. But I think what we know from the evidence-based care and science out there, as well as just basic common sense, probably, to be honest, if we add all of those and let's say one goes haywire, we don't know which one that is. And so then we're flaring you up unnecessarily, versus if we can be a little bit calmer and slow, slow but steady is going to win this race. So just add one little thing at a time. Then we found much more success that we know either what might flare you up, and now we've got to work on that a little bit more, maybe take a little longer before we add it, or vice versa. It goes swimmingly. Then, hey, let's keep cruising on that. We know that goes well, and add just one more thing the next time, or give you tools. Maybe I don't even need to see you, but in 2 days, I'm allowed to add this. Then the next 2 days, add the next thing and go forward from there.
Yeah. You were real good about watching me and saying, you can add this. And then a couple days, you can add this. I can. I was so excited.
Yeah.
Oh, this is great.
So I try to give people guidelines so they don't have those questions, right? Because I think the unknown makes it harder, versus if you have specific guidelines, I get to look forward to this. And then you're part of the process, right? You are doing just as much of the detective work as I am as the PT. Did that respond? Did it respond how I wanted it to? You can figure it out. And if I teach you that even better, guess what? You can do it on your own next time. So then maybe you don't need me. So I might have just worked myself out of a job, but
never.
No, joking aside, people are going to get hurt, right? But I would much rather have you be independent, be able to manage and figure it out on your own, and empower you to be able to make those same decisions and know why I'm doing what I'm doing. So then on your own next time, you've got it.
Yeah, I've been doing my same PT exercises every other day for 8 years now. I think it's been 8 years.
So this is the cool thing, right? You again handled it very well. And I think said the opposite of what like 95% of my patients say when I say like, really, this is kind of a lifestyle change. You need to keep up with this. You were like thrilled about it and like, give me more, which I love. But I would say, and I know you were surprised when I told you this, like most people, it's the opposite. They're like, wait, I have to keep doing this? Like how long? Forever? To them, that's very daunting, especially for someone, like we said, that has not had exercise as part of their life. That's a lot to ask. And I try to be very, very realistic to that knowledge of where are they at on the spectrum. And if they need, if they haven't done anything, maybe I only give one or two that they keep up with forever. But I always use the dental analogy. I think it strikes home with most people that, you go to the dentist, you get a good checkup, they clean your teeth, everything looks good, you have no cavities, you leave, you make your appointment at the front desk for the next 6 months or year, whatever you do. You don't get to go home and never brush your teeth, never floss your teeth, and expect to come back in 6 months and not have a cavity, not have, tartar buildup, not have pain. So really, why is our body from physical therapy, and our bigger body any different? This is just our teeth, one small area. If we don't take care of our muscles, our joints the same way, how would we expect to come back to a checkup and have our bodies perform that way too and not be hurt or have issues? So I think most people kind of hear that and are like, oh yeah, you're right. So if I do have a weak core, for example, and weak abdominal muscles, how do I expect my back not to hurt if I go to PT, I get my core stronger, it gets better, but then I never work on it or use those muscles again? Guess what? Your back pain's probably going to come back. And if patients can see that, they can kind of see why we're giving you those tools, but you've got to keep up with them.
Yeah. And my motivation for adding the PT exercises every other day is because I don't want to feel terrible. I don't want to injure myself because I've had so much pain. I don't want to experience that again. So it's my motivation to keep doing it.
And pain is a powerful motivator, right? And I would argue, or it should be, maybe we should say.
It is for me.
Especially when you have a tool that can get rid of it and that, like you've put that connection together and I try to tell people too, you put in the hard work. The hard work was climbing the mountain, getting that strength build up or getting the flexibility better. Now you get to just ride that ridge line. So like you said, it's every other day now. Whereas maybe when you started, we had to do it twice a day. You've put in the hard work. Please keep up with it because this is the easy part. Like that's far easier. You have to do far less than if you stop and we slide back down that mountain. Now we got to reclimb it. And that's just more frustrating, right? Reclimbing the same mountain. And it's just more work again.
Yeah. And it's not that it even takes that long. I mean, 10 minutes every other day?
And that's where
me
we really try hard as physical therapists, myself, this is a priority, is to make it realistic and meet you where you are. Right. So if 10 minutes works for you, if 5 minutes works for a different patient of mine, I try to always ask that question to know, what is it? How long do you need? What are you willing to do? And then I'm going to give you that so that, again, there's no excuses. How can you keep going with it?
Yeah. Do you think that stretching at an early age is important for when you get older?
Great question. Yes. Well, and I would say stretching and just certain foundations of movement, strength, just in that health kind of category, physical health category. So I wish I knew a fraction of what I know now, or that I had the fortitude to do it when I was like 15. I mean, I didn't know it, but even earlier on in my 20s, I would say I wish someone had told me some of the stuff.
I don't need that. Why do I need to stretch? I can just go lift weights. I don't need to do anything. Yeah.
That's the problem, right? Is when we're young, we can get away with it.
Yes.
Your muscles are more pliable. So as we age, our elasticity in our tissue gets less. No different than me getting wrinkles now because my elasticity in my skin's not the same as when I was 20. No different than what happens inside your body. Your muscles, your tendons, they're the same. So they get less elastic. That rubber band doesn't have quite the spring that it used to. So back to your question of flexibility early on. Yes, if you can establish that window to be on the higher end of that range, then you're going to just set yourself up for more success. You've established it. You use it every day in your life. If you have the flexibility, strength, whatever it is, then we use it, which means it's easier to maintain. I will put a clause out there that we all have a genetic component there. So my flexibility might be different than yours and someone else's. So I have, this window that I can work within. I want to live not in the tight side of that window for me, but on the high end of it. And no different. Yours might be over here, better than mine, but same, you still want to live on the high end of that. And so putting in the work allows us within what our genetics and just, makeup allow to live in that kind of best of what we can. So all you youngins out there, do your exercises, work on your flexibility. You heard it from us.
I was going to say, what do you wish your clients knew years before they were injured?
That might be it, right?
That's it.
Yes. And this is kind of a little tangent, but I think, yes, I wish you knew to take care of your body, sooner. You only get one of them, right? And so,
yes.
Treat it well and take care of it. I think if anybody knew that, it would be important. The other one, and this ties into kind of, I feel like my bigger belief as a profession, as a physical therapist is, I really wish the insurance companies and the medical system and like the medical practitioners, primary care providers who you do see most people every year for their check-in, their physical, would also be a little more knowledgeable and on board with physical therapy and its value. If they, like the dentist analogy we talked about earlier, referred people to do a PT wellness check every year, could we potentially catch those issues that people have and impairments earlier and give you the specific tools that are individualized to you? So your issue might be different than mine, but if I could evaluate you, no different than a physical. Some people have high blood pressure, some don't. Some people have tight hamstrings in PT, some don't. But if I could know that and evaluate that yearly, then could I give you the tools so that you knew exactly what to do really efficiently for your body? And then we check in a year, see if that's improved. So why are medical and insurance industry doesn't have physical therapy as part of a yearly check-in? It's frustrating to me. It's one of my kind of platforms I would love to, in my free time, try to really work towards promoting on the bigger picture of how do we get our profession and that information out there.
Wow, I haven't seen you in like over a year. Can I just come in for a check?
So good question.
That would be great.
Insurance is getting better, but they still don't love wellness care. But this is where self-pay for a lot of people, it's worth it. Is it worth spending the money on yourself, right? Think of what we spend on, from supplements to getting our hair done, to going on a date night, you name it. What if you put that same money to an hour of time to just make sure that next year you're not getting hurt? I think you could make a strong case for that, even if insurance isn't covering it.
Oh, I love that idea.
Well, maybe I'll see you on my books in the next week or two.
Like you,
I really wasn't doing this to just generate patients.
Okay, here's a question for you.
Okay, I'm ready. Fire away.
What's your opinion on push-ups, running, and sit-ups?
You just loaded me up with 3 hot topics.
I knew you'd love it.
I know, I do love it. So let's start with push-ups. I think push-ups can be a great strengthening tool. They're easy to use at home. From a PT standpoint, the function of a push-up, it wouldn't be my number one choice if you were like, I'm going to choose 3 exercises to kind of continue with. Reason being that depending what you do for a career, I guess I should put that out there, sport, but strengthening, it really strengthens the pectoralis muscles in our chest. And most of us are already too tight in our chest. If anything, we're too strong there. We use it all day. Posture and gravity tend to want to pull us forward. So if I had to choose, I would actually have you stretch your chest. So open that up, because that's going to promote bigger wellness issues of kind of spine health, less headaches, better posture for our shoulders. So that would be my take on push-ups. Do a stretch for your pecs versus a strength if you had the option and you only have a little bit of time. Not that, again, you can't use it for strengthening, but just get into the nitty gritty. Running. A couple thoughts on running. And I'm going to put a clause out there. I'm not a runner, but I am passionate about exercise and certain things. So if you are passionate about running, I want to help people meet that goal because I believe you should do exercise that makes you happy. We should find joy in what we do. And so if that is the tool that works for you, or you need it to do another, whatever you want to accomplish with your goal, then I think as physical therapists, our job is help you get there. I want to make you better and more efficient at it so you can do it with the least amount of breakdown on your body. It is harder on our bodies though. And I think there are potentially some other exercises that might be easier on our body. And again, it really goes back to what's your injury? What does your running form look like? How the volume, your training volume, how much of it are you doing? In what conditions? So from that standpoint, I think it really varies on a lot of things. If that answers the question there.
Well, like what type of injuries do you see with running?
Great question. Pretty much across the gamut, usually lower body injuries. Knee is probably the primary one, knee injuries with running, although it can be ankle, hip, back as well. Those are probably the bigger areas we see running injuries in. Ankle and foot I should put together, obviously. So the ankle, foot, and then the knee. But again, they can be overcome. So as long as you're doing proper training with it, using the proper, shoe wear, that we're ramping up correctly, it can be a good sport in that sense, but you've got to be smart about it. And I think a lot of people just don't have the knowledge to know how to do it correctly or how to ramp into the training correctly. And then your sit-up question. And I think this is a loaded question, that sit-ups are my least favorite core exercise. So without getting too involved of why, but I want to give the viewers and the listeners a little tidbit. There are a lot of better ways to do your core. So sit-up gets the rectus abdominals, which is the top layer of your abdominal muscles. So you've got 4 layers. The rectus flexes the body. So like a sit-up, it pulls us flexed. Functionally, how many of us flex really hard forward like that? If anything, that just put me in poor posture, right? So there are other abdominal muscles. If anybody wants to do a little Google search, transverse abdominals is the deepest, the layer, and the most important to your back health, your posture. It's what gives us that flat tummy. So we have also an aesthetic component to why we might want to work on that. But more than that, as a physical therapist, it is probably the biggest bang for the buck in terms of helping to support the spine. And so there are a lot of different ways you can fire that, both in everyday life function, but also in just core exercises you do. And so I really try to focus on, again, what's going to give my patient the muscles that they need and how they're going to use them in life. And so the sit-up really doesn't work that way. So there's a lot better ways to do it that I believe.
I know when I've done sit-ups, even if I try to do them right, my poor neck.
Yep. See, for a lot of people, right? And that tells you something. What are we doing? We're going into this massive flexion response. Our neck is locking up. And even with right, or even when they tell you, prop your hands behind your neck to help, watch anybody do it. There's no one, that's maybe a bold statement, but very few people do it correctly and are able to turn both the neck off, or that they're not using their hip flexors. So that's another one. What pulls you up is not necessarily just your abdominals, but the muscles in the front of our hips that bring us forward. Those also tend to run really tight in the majority of our population. A lot of us sit for work, and when you sit, those muscles shorten up and get tight. That is a major cause of back pain. So if we can keep those hip flexors loose and not do exercises to try to get them better, i.e. a sit-up where you're actually making them tighter, I think, again, there's a lot of better ways to do it. And then just go stretch your hip flexors too, which you know about that as well. They're important. Yep.
Back to the running.
Yes, let's go. Oh gosh.
So
yes.
Do you see injuries from people who just run on a treadmill? Is there a difference between running on the pavement and running on a treadmill?
Yes. So there is a difference. If you think of running outside versus a treadmill, the treadmill is moving underneath you, right? Versus we propel ourselves on the ground outside. So already the mechanics are going to be different. Now, around like an area like Seattle area like us, where it's raining a lot and a lot of people don't want to get outside, or just logistics. You've got a kid at home, your baby's sleeping, you can't necessarily run outside. So I'm not saying don't use a treadmill. I would rather have people exercise versus not exercise, but it is to answer your question, it is definitely different, and different muscles are activated in a slightly different form. So it doesn't mean you can't do it, and it's not very similar in good exercise, but it definitely uses different muscles for sure. And so the injury patterns we see, some are similar, some might be slightly different. So I think it just varies on that front.
So if someone just did the treadmill forever, do you think that they could still get knee injuries from it?
Yes.
Back
yeah.
injury?
Oh yeah. Sorry.
Okay. Even though it's even and right under you.
So it's even, it's better in that, well, it's different in that sense, right? So it's even, but you can still, if you just did the treadmill forever, 100% you can still get injuries, whether that's walking or, running on it. I think, again, it's good, but you could also get injuries just doing that outside, right? As well. And even the treadmill, think of it as a carryover. Our lives are not that perfect and flat, right? So you do that, but then you take your adorable puppy who's sleeping behind you, I just noticed right now, but you take him out for a walk, right? And they're pulling you, there's a pothole in the road, you're on grass. If we don't also train our bodies to be able to navigate life like that, there's another chance that injuries are going to happen because we haven't given the tools the tools aren't in our tool belt. We don't have those tools yet. How are we going to go navigate without them then?
You just reminded me of something. When I was coming off my injury, I said, well, can I walk the dog? And you go, yes, but make sure that you have your core engaged just in case she pulls. And so I always remembered that no matter what, whenever I'm out with her, I remember that. Or if I see another dog go by, remember our other dog used to just lunge at other dogs. So you'd say, just hold on tight and engage your core, bend your knee, right? Is that what you said?
So, yes, you're absolutely one. Good memory. You get an A+ as a student alum. You are look at that. I'll send you your stash later, your certificate to hang on your wall. But no, you're absolutely correct. My patients get tired of me saying this because I probably sound like a broken record, but it sticks, right?
Yeah.
The concept of the core and preset or engage the core before the thing's going to happen. So if you know your dog's going to pull, or even let's say you're going to lift something heavy, do you already have the core engaged so that it's like a back brace, your body's already ready to go. It's your body's natural back brace. Then you're not going to get twisted in a way that potentially has an injury resulting from it. And that goes back to even just having a light activation of our core. You probably have it right now, just sitting, talking to me. I have it. So part of that is just holding our posture up. If we have that, not saying we're bearing down and we can't talk to each other, but if we have that little bit of activation of those muscles, and it's going to hold me in the right posture and I'm ready, right? So even when unexpected things happen, that's going to give your body that chance to react that much better and lessen the chance of injury.
Yeah. And I also just remembered, I would go to you and I'd say, my back is killing me because I sneezed.
Yes.
And you would say, well, if you're about to sneeze, you have to activate your core quickly. And because it makes it where it's less, you get less of an injury from your sneeze.
Less jarring, right? And if not to say that plenty of us don't sneeze or have things happen where it jars us, right? And hopefully in a healthy situation, your body can handle that. Yeah. But as you're recovering from injury, and we know that either a nerve is irritated or, tissue is more vulnerable, it's healing, right? So no different than if I have a scab on my knuckle and I cut myself, as things are healing, that tissue is more vulnerable. Our body's working to kind of create a network to make it more stable. And so if we can use our muscular system to protect it so that we don't get that quick force, it's just going to have that much less of a chance of tearing or re-injury happen.
Yeah, sneezing can really throw you for a loop.
Yeah, personal story, I may have thrown my back out sneezing one time too, even as a physical therapist. So it can be done. And that's when you're getting old, when you sneeze and suddenly you can't stand up or walk afterwards. That is a longer topic than we probably have time for now, why that happens, and it wasn't just the sneeze, obviously. No. I feel like I have to say that injured it. There was a lot going on for all of us. Leading up to that was, the straw that broke the camel's back, per se. It was the tipping point. But I think, like you said, we can learn from it, and there's preventative, things you can put in your everyday life.
Yeah. How does lack of exercise or being overweight affect your joints, and how can PT help with that?
Oh, great question. Yes. So when we're deconditioned, So lack of exercise, lack of, muscle strength, cardiovascular strength, often comes hand in hand with, being overweight. I think they work in two different ways on our body and why they can, increase injury. If we don't have the muscular system or the flexibility system to support our skeleton, it's going to be more vulnerable, right? It's like this tippy system that doesn't have a nice support structure to it. So we need that strength and we need that conditioning. And then to that there, we fatigue faster. And so when we fatigue faster, our systems are vulnerable, right? No different than you can see it in yourself. When you get tired, we get sloppy, right? Our mechanics are sloppy. We walk sloppy. We drag our feet. We sit sloppy. We're in, poor posture because we're worn out. Again, our system is meant to do that. It's not meant to do that all the time on repetition. And that's when usually the repetition is what gets us into trouble, when we're always sitting in crummy posture or when we're always sloppy with our movement and how we lift things. Then over time, things like a rope fraying, it's going to fray, and eventually it's going to break. The second piece of that you asked about is being overweight. The biggest factor in having, extra weight is that it puts more pressure on our joints, and it's exponential. So 1 pound extra overweight does not equal like a 1-fold increase of pressure on our joints. It really ramps up even more than that. And so I think the biggest thing we can kind of let people know is that, there's an importance to being at a healthy weight just to keep your body, we only can get one of them. So to promote as much as we can, lessening of that breakdown process. We're all going to age. We're all going to break down. It's kind of the cost of living and having fun and being out and being active. But if we can lessen how fast that happens and the pressure on it, we're setting ourselves up to be able to continue to use it and have more fun throughout the years. And they go hand in hand, right? If you can't exercise, you gain more weight. And so we want to reverse that. Let's exercise, then our body weight is healthier.
Do you ever get patients that don't do their homework?
Yes.
Their PT homework.
It's as much as it breaks my heart that not everybody listens to me. I know it's tough. No.
Well, there's a lot of people listening now. So
okay, well, good. Then this is my moment to
shine.
So
this is your moment to shine.
Please listen to your physical therapist. She knows what he or she knows what they're talking about. So no, it is. Yes, we get a lot of people that don't do their exercise. I think it's twofold. I think some therapists are unrealistic sometimes in what they give, or they're trying to do their own goals, not the patient's goals. So that's part of our practice, and myself specifically, I really work hard to listen to what your goals are, because really at the end of the day, it doesn't matter what I want. You've got to live this life, and you've got to be motivated by those goals. So if I can work with what you want, that's going to make you more likely to do it. So I feel like I work really hard at that, and that helps that most of my patients do what they're supposed to. But there are still people that lots of barriers in life happen. And I also try to be realistic to that we all have barriers, from financial, time, childcare, emotional, there's hurdles. And so if we can also be open about those so that I can best help them know how to overcome them, then that's another one of my goals, is figure out what those hurdles are and how can we get around them, because that's going to make you, more compliant, which at the end of the day, more compliance isn't just about me checking a box to say, yay, you did it, but you feeling better, right? And that's going to be motivating. You don't hurt. But there are always still people at the end of the day that don't. I think what I've learned through doing this for a long time now is I can do all those things, do my best to try to meet their needs and figure out what those barriers are, but I'm not there living that life with them. And at the end of the day, if they don't choose actively to be that participant and do it, I used to take it really personally early on in my career, like it was a distinct reflection of failure on my part. And I have learned that was unrealistic pressure on myself, that they have to make that choice, and they've got to either choose to live with that pain or to be proactive and try to do something about it. I will always take ownership of, can I do something different to better help them? But if we've exhausted those avenues and, they don't choose to do it, then, we may have to have that conversation that it's just not the right time in life for physical therapy or getting better. And that's okay. I'm also very comfortable now having that conversation. Maybe this isn't the right timing for you. And don't feel guilty for me. I'm here for you when you need it. Maybe you need 6 months, deal with the other stuff first, and then come back when you're ready, and in that mindset to make the change.
I love that. You're so kind.
Oh, well, I think I love being able to help people at the end of the day. And I know that it makes a big difference in their lives and their, bigger life than just the physical part of it.
Yeah.
That, as we talked about earlier, it ties to so many things. And so if I can be just even a little bit of help and inspiration, or, someone to walk that journey with them, I want to be able to do that.
Yeah. And kindness goes a long way.
Correct. That might be a good note for us to wrap up on, because I 100% agree. Like, if we're coming out of this, just life in general, big philosophical, I believe in that as well, not just in the physical therapy world, but I think, be kind, be kind. You don't know what is going on in other people's lives, what they're going through. And you said it, it really does go a long ways, and it just, in us being understanding. And if we even give a little bit of that to someone else, then do they pass it on to other people, share that same kind of understanding with someone else. It'd be cheesy, but the world would be a better place, right?
Yeah. Yeah. So,
yeah.
Okay. So is there anything else that we didn't cover that you would like to share today?
Oh gosh, that I was not anticipating that question.
But you were anticipating all the others, huh?
No, okay. No. But I can talk shop all day, right? You know that it doesn't take a lot for me to be able to do that.
Like what one thing?
Not the quiet kid in class when I was little. Yes. What did you say? Sorry, one thing that I want to share.
What one thing would you like to share, or what piece of advice would you like to give for preventing injuries, maybe?
Okay. So I think, to be put on the spot with it, but I think good. I think if I could share one thing, is just do one little thing for yourself every day. And I would say that goes to prevention of injuries, because if we care for ourselves, I think we will see it pay off in dividends. So I'm also going to make a broader statement that I don't think that always has to be physical things. I think it can be. So if that's just going for the walk with your dog, or, taking 5 minutes to meditate, or even 5 minutes just to be by yourself, if that's what you need, you name it, right? It could be a lot of arenas. Making a healthy meal, taking the time to make yourself a lunch versus stopping and getting fast food. But if whatever that is for each person, and it will be very different for all of us, but I think if we all just took a few minutes every day and don't look at it as, a guilty pleasure. It is investing in yourself and betting on yourself, buying, time for you back. I think honestly, the injury prevention will come, because movement is key to all of this. And us, in the health and wellness journey, if we could all just take care of ourselves and give ourselves a little grace, I think we'd all be in a better spot.
I love it.
Well, good.
Words
Thank
to
you
live
so
by.
much.
Yes. Thank you for coming today. I know you are swamped with.
Oh, I do. Now I'm heading out, and I've got a patient in about 15 minutes here. So I'm headed to be Dr. Kertson now. And, but I really appreciate, yes, you inviting me, having this conversation, easy, fun. And yes, look forward to seeing you maybe next week for your wellness checkup.
Yeah, thanks for coming. And it was just so great to finally see you again, even if it's just
seeing
on
your
Zoom.
face is great. Yes, you have a great rest of your day. Thanks, Kim.
You too. Bye.
Bye.